Good evening, everyone. This is Dr. Vrishali here, and I welcome you all to the round table. Unfortunately, we are having some technical issue, some short glitch, which should be get sorted in 5 minutes. Once that is done, we will be starting with our today's round table. Meanwhile, if you have any questions, the chat box is open. You can start punching in your questions, and our panelists will look at it during our discussion. Thank you. Dr. Jagose, sir, can you till then just speak a little bit about NJH and its activities?
Okay. So good evening, everybody. Welcome to the roundtable conference on monsoon ailments. As you all know, NJH is a very old journal. I think so. Its inception is since it is since 1992, and since then I am a member of NJH, and it is slowly picking up very well. Many new members are coming, and we have got a variety of activities going on in NJH. We have the roundtable conference every month on the fourth Saturday, and also we have got webinars on the second Saturday, and we also invite articles from various professionals and other authors or writers who are tuned to homeopathy, and they can submit their articles directly to the NJH, and if possible, if you follow the guidelines what we are giving, and if our editorial board approves of it, we can definitely produce your articles in NJH, and it goes all over India. So the advantage is that, number one, you will be very well known to other people if you are new or if you are old. Again, also you are well known. Your clinical expertise will help other people also by solving their problems if in their practice they get such a similar case. Also, seeing different people's cases and how they prescribed also gives a good viewpoint on how to practice or how to improve your practice, or what lacunas you have in your practice that also you can improve. And any difficulty anybody has, I mean, we all are one family. We definitely get together and solve each and everyone's difficulties, whatever they are having. And in this way, we learn more, and we are in a constant process of learning, no matter how senior we are. And in this way, it helps us to grow and become more successful in practice.
Thank you so much, Dr. Jagose. You rightly mentioned that NJH is a place wherein we all grow together, and that is the precise reason why we are all the 30 plus, I think now. We are striving hard to bring quality material every month to our audience, and based on the same lines, we are also starting with NJH Masterclass now. So next month, we are starting with Dr. Ajit Kulkarni sir's masterclass, which is on Solanaceae, nightshades. He's going to take us through a beautiful journey of learning Solanaceae family in details. So I would urge you all to look at our Telegram channel and register yourself for those masterclasses as well. Now, I think Dr. Yogesh, we are waiting for him to join. Meanwhile, I'll just give me a minute. Yeah. Dr. Yogesh, are you there? Not yet. Okay. I request all the participants to kindly keep their cameras off for this 1 hour. This is the 9th roundtable conference which we are having. This is one of its kind, wherein homeopaths with a very big practice are coming to you with sharing their, kind of trade secrets, their practice tricks, and some methods which they have learned over such a long practice of homeopathy. And, this is going to directly help you in clinical practice. So you're sitting in a clinic and you get a patient. So we prepare you for every season. Like in summers, we did sun allergies. Similarly, today we are bringing in monsoons. Monsoon is such a delightful topic, we keep waiting. The hot, scorching summers make us wait and wait and wait for the rain. And once the rain starts, then we start grumbling that, why rains? And we also have various kinds of sufferings. We, as I love to call myself as a general practitioner in homeopathy, we get all kinds of patients. So we are not specific to one particular illness. So as a general practitioner, I become the primary caregiver to every family, and every season brings about its own challenges. So monsoon is such time wherein, the schools have reopened, where sudden changes are there. Sometimes the days can be really, really hot and nights can be very, very cold because it has just rained in the evening. And then all this weird combination of weather brings about lot of illnesses. So here we have our panelist, Dr. Yogesh NITURKAR, also with us. So let me just introduce you with the panel, and then we'll just directly start with the with today's roundtable. Okay. Right at the onset, let me just tell you that we have a technical glitch, and if at all sometimes I vanish for a few minutes, don't worry, I'll come back soon. Okay. So here we have Dr. Asrani sir, our we love to call him as brain of NJH. Yes, sir, welcome. And Dr. Praveen sir is rubbing off on everybody. So today Asrani sir is also in the car. All right. Then we have Dr. Jagose.
Hello.
Yeah, he is, a teacher from Teaching from Heart. And I think your YouTube channel is also doing great, sir. So thank you so much for joining us today. Dr. HEMA PARIKH ma'am from Gujarat. Yeah. And Dr. Yogesh NITURKAR from Latur. And this is your moderator, Dr. Vrishali Saraswat from Mumbai. So I welcome you all to the 9th Roundtable Conference on Monsoon Ailments. And should I ask you to start the webinar, Dr. Asrani sir? Can you just highlight what ailments we should be looking at?
Actually, the ailments of monsoon are not only restricted to monsoon, but they occur more commonly in monsoon. Nowadays, we know that dengue has become endemic, typhoid has become endemic, infective hepatitis has become endemic. Only leptospirosis is something that we don't see that much in non-monsoon period. So common ailments that we see are viral fevers. COVID, of course, is a virus, but then we don't see COVID in monsoon. We have monsoon general viral fever. We ask the patient first question, "Pani mein bhig gaye the kya?" Then we have upper respiratory tract infection. We have malaria. We have dengue. We have leptospirosis. We have chikungunya, acute gastroenteritis, and infective hepatitis and typhoid by eating unhygienic food and water. These are the spectrum of illnesses we treat in monsoons more often. And as a treating doctor, we always talk like season acha hai ki season acha nahi hai, depending on how much volume you have of these patients. Yeah.
Thank you, sir. Dr. Jagose, can you highlight on as a homeopath, which all ailments do we see very commonly in monsoon?
Okay, so as Dr. Asrani sir correctly said, we see a wide variety of ailments which are coming in, which sir has just enumerated for us. So in our practice, you see, once the summer ends and the scorching heat, the rains bring relief to the scorching heat, and a variety of infections, they come to us because of contamination of food and water. As Dr. Asrani sir correctly said, we get typhoid, leptospirosis, we get dysentery. Also, you can add pneumonia in the list also by getting wet in the rain. And cold, cough, fever is very common, diarrhea. So all these cases we are seeing, especially small children who come with their parents who complain of recurrent cold and cough, cold and cough. It may or may not be aggravated in the monsoon, but it does continue over a prolonged period of time. You see, they are on antibiotics for practically 7 to 8 days, or even sometimes 15 days in a month. Every month they are on antibiotics and they do not respond so well. So such cases where the recurrence has to be broken down, in homeopathy, we have got a good choice, rather a good scope also. Also, we see cases of asthma which come to us many a times, and they're already on treatment with the modern medicine. So in conjunction with modern medicine and an adjuvant with homeopathy, we can also give good relief to the patient. And if the patient improves, with the permission of their treating physician, we can reduce the dosage also, and we can slowly but and gradually uh, take the patient off all the medications. Of course, an exception is the steroid. If it's on steroids, it will take a long, long time for the patient to come out from the steroid therapy. And we also see most common cases of, again, fevers which come to us, but directly nobody comes to a homeopathic doctor, you see, for a fever. They will always go to their general physician for a fever. If it again recurs, or if some lingering effects are there, like weakness, cough, headache, whatever it may be there, for that they will again come to us. But per se, for fever, if you go 100, 102 fever, directly they would ring up the GP and say, I mean, what medicine to take. They wouldn't go to a homeopathic doctor. That's the sad part of it. And I mean, that's what we are seeing in the practice. You see, when we ask them, why don't you come to us directly? They said, no, doctor, our GP is there. He's near our house. So we would like to go there first and take treatment. You see, homeopathy is very slow in acting and so on and so forth. You see, so this is what we are seeing.
Dr.
Also,
Jagose, shall we break the myth that
yes.
people don't come to us first? I think as a hardcore clinician, I beg to disagree. People do think of us as the first choice nowadays. And I think Dr. Hema ma'am, can you share a case quickly on that note that, you know, how fast we can give relief? You're on mute, ma'am. Unmute yourself.
Sure, sure. Yeah. Hi, good evening, all. So I definitely agree with you, Rushali, because I think it depends on the education and orientation that we as a physician do with our patient and their trust over us. Many a time it happens so that we have to tell, please go and take some other medicine because I'm not able to help. That is also a case at times. So I think there is some question in chat box also. So let me talk about fever. Dr. Jagos sir has already talked about. Another important point I would like to add is skin disorder, which we have missed, which is very again common with monsoon. So malaria, I think we all like fear treating that. But what I feel that there is a nice question asked also that how to take a case of fever, especially according to the stages. So I think approach to fever is very important, which is totally separate topic. But if it is viral, your approach is different. But if it is malaria, your approach is going to be different. And there what I feel is that we need to take details according to the stages, that how it started, what were there in prodrome, then chill, then heat, then sweat. So those are very important aspects, and we have formed a format that how can you go ahead with case taking in malaria, and then how do you analyze the symptoms, and how do you come to the remedy in cases, because it is little different. Even time of administration of medicine is also different when you talk about malaria, which Organon is already talking about. So I'll just talk about a small case that there was a lady, 40 years old, who who had a complaint of fever, which was high grade, and it was in the monsoon, and I had to go for visit to that lady. And when I went there, I took, like, there were many details which would definitely take you to the remedy, that she had washed clothes and she had got wet in rain and everything. Most important point which I could come across in the case was the stages, the characteristic of stages. And that was that it's fever, like it started with hit, then there was chill, then there was hit, and then there was sweat. Now, intermingling of stages in cases of malaria becomes very important. And when I went to BBCR, because malaria is very well talked by LNs and of course BBCR. And in the chapter of complex fever, there is only single remedy given, that heat, then chill, then heat, then sweat, and that's only Rustox. And Rustox 1M, one dose, single dose was given to that lady, and she recovered completely. So I think selection of right remedy and administration of medicine at right time with right potency, we can definitely produce wonders. So that is simple example, but then that Rustox definitely came up, but your confidence is much more. So rather than 200, you would go for 1M, that this is the remedy, because that's a single drug rubric. So that's very important.
Lovely, ma'am. And I just will highlight 2 points which emerged from this talk was,
Yeah.
First, we must educate our patients to accept and take homeopathy as first choice of treatment. So the onus is on the physician. And for this first responsibility, I think what you mentioned, second point, was very important, that you have to demonstrate results.
Yes.
And third point, I think, was single remedy rubrics. I just love them. They are the tried and tested ones. So if you are hitting on a single remedy rubric, just the results are fabulous. So thank you so much, ma'am, for sharing this.
And we also are, Vishali, supposed to be aware about our limitations also. So we may not just cross that, as JAGOSE said already.
Yes, yes, yes. I agree. So with due respect to every system and every method in its own place, what I want to mention is we do have solutions for a lot of things. We must try them with our full, dedication. Yeah. Okay. So my next question would be, as a common man, how does monsoon affect you as a common person? Yogesh, do you want to take the question?
Yes. Before I proceed, what Jagos sir was trying to say was those who are not on homeopathic treatment for any of the complaint. So it becomes a roundabout, that they are moving around and they are taking treatment because fever is not subsiding, or many times it happens in pediatric cases that the child is not taking medicine. So there is no option to other than to have some alternative. So homeopathy becomes the choice for those who are new to the system itself. But already those who are on homeopathic treatment for any of the reason, they prefer directly to go for homeopathy itself. So that is the thing. And again, I would like to add upon that standardized clinical record, SCR, is having that part of fever totality. It is very good thing that how we can take a case related to fever. So that is the another thing. And what I had seen in practice is commonly is recurrent typhoid during monsoon period. And in that, in my experience, I had seen phosphorus 200 single dose has worked miraculously in recurrent types of typhoid.
Are you suggesting it as a preventive, or when somebody gets recurrent typhoid, that time you are going to give it?
Recurrent. Not as a preventive, but those who are having typhoid, they come frequently at that period of time. And it happens that within 3 to 4 months they are having that repeated typhoid also. So the first onset, if we are giving phosphorus 200, they come out of it, and most probably they don't get any other type of complaints during that period, whole period of monsoon. One more thing that I would like to add is about asthma and musculoskeletal ailments are also very predominant during these phases of monsoon, as well as the continuation of monsoon, then the winter season. So acute exacerbation of chronic complaints is very commonly seen. Constitutional as well as acute remedies also play an important role. And what you are just mentioning, that how does it affect common man? Now during monsoon there are lots of temptation. Getting wet in rain, that is one thing. Having lots of tea, second thing, with ginger, added ginger. I had 3 times of tea since 3 o'clock. So again, that is another temptation. And then the fried foods, that is also very common. Let's go for pakoda because it is raining. Let's have chai. So that is also very common. And there is another category, those who don't want to get wet itself. They are aggravated during this period, so they avoid it. So from homeopathic point of view, it is very important to understand that how much it affects to those who are not inclined to or disposed to get wet because of their some sort of inconvenience, or the complaints are aggravated.
Yes.
So that is there.
Absolutely, I agree with you, Yogesh. There are a lot of things which surface. So you've mentioned it very beautifully. There will be personality types which you can understand just by asking how do you react in rains, or how does rain affect you. That could be a very beautiful question for defining constitutional as well. So beautiful point. Yeah.
Can I add something?
Yes, please.
This is Dr. Rahul.
In repertory fear.
Excuse me. I'm so sorry, Dr. Rahul. This is a panel.
It's okay.
Discussion.
I'm sorry.
Yeah, so, we would really appreciate it. How much ever we love to talk to our audience. Today, right now, that's not the time. We are already running late. I'm so sorry. Just put it in the chat box and I will take it up with the panelist. Yeah.
I would like to add 2 things here.
Yes, sir.
A patient coming with long-term fever,
yeah,
you have to confirm that there is demonstrable fever on thermometer.
Yes.
Because many a times patient is treating, I have seen patients of 20 days duration, temperature not taken even once. So
absolutely,
you have to have a chart which you should give to patient for monitoring every 2, 3, 4 hours. Secondly, typhoid recurrence or relapse is more misdiagnosed, because typhoid, as per latest Indian Council of Medical Research guidelines, you cannot diagnose without a culture. It is Vidal, if you do, it is always positive.
Yeah.
A person who's had a typhoid, Vidal will be positive, I think, for next 10 years. Secondly, do you have a fever that can justify typhoid? Like, I will tell you in one simple line, a fever of 102 and 3, which does not go below 100 despite even 2 dolos or whatever medicine you give them, that is typhoid. And when you start specific typhoid medication, even homeopathy, then if it breaks in 12 hours or 2 hours, then just refine your diagnosis. It is not typhoid. It takes 48 hours. First, the continuous fever will become step ladder pattern, then it will go. So I would always say that before you label a patient recurrent typhoid or relapse of typhoid, make sure that it is truly a typhoid and not anything else. Thank you.
Yeah, thank you so much, sir. That makes a lot of change. So, I would also, if you can continue, sir, a little bit as to what clinical examinations must be performed with cases of fever coming in monsoon especially, and what investigations we must order. Sir, you are on mute.
First thing is that you have to measure the patient temperature in armpit, because mouth, you don't know what they have consumed in last 1 or 2 hours. Secondly, you have to measure the oxygen saturation in today's time. We have been measuring it for last 10 years for every patient. Then you start examination from head to toe. First, you look into the throat, look into the nose. If you see eyes suffused, reddish eyes, throat congested, patient may tell you, I have pain. Ask a specific question. Swallow your spit. Does it hurt when you swallow? No, sir, it doesn't hurt. Then you know that you're not dealing with a acute pharyngitis or laryngitis. Then, if you have signs of upper respiratory infection, what we call as a localizing signs, then you treat it like that. If it is not there, you auscultate for a wheeze. Wheeze, particularly you will auscultate in a patient who has a history of chronic bronchitis or asthma or COPD. A patient who's elderly, having hypertension or diabetes or a known case of coronary artery disease, you auscultate the bases for RALs because they may be getting into failure because of fever. A patient, if chest is clear, tell them to bend the knees, examine for liver and spleen, because enlarged tender liver, infective hepatitis, enlarged spleen, normal liver, malaria, and hepatosplenomegaly, typhoid. You cannot examine spleen in supine position because liver comes up to the costal margin, spleen does not come up. So turn the patient in right lateral position. Ask the patient to bend the left knee. Left knee comes near the umbilicus, right leg is straight. In that position, you palpate the spleen. That is the best chance you have of palpating the spleen. If the spleen is very enlarged, either nearing the umbilicus or crossing the umbilicus, take history of duration, because this is likely to be chronic myeloid leukemia. Of course, before you start taking history, start asking for any travel history outside. If it is Bihar and huge splenomegaly, it is Kala Azar. Then, if you get no localizing signs, and you have a child who has a fever of 102, nil throat, nil chest, nil abdomen, look in the private parts. Half the time you will hit pay dirt, a balanitis or a vaginitis, which is very easy to treat, but very few doctors will do that. So, examination like this. Investigation wise, a UTI in a child can be fatal. A UTI in an adult diabetic can be fatal. Or UTI in a 70-year-old can be fatal. So my first investigation, if the fever is not breaking in 24 hours and patient is not comfortable, I'll ask for a CBC and routine urine. I will not ask for a fever profile, malaria, dengue, lepto, blah, blah, blah. No. I should ask for a test when I can tell myself, what do I suspect in this patient? Yes, CBC will give me a lot of information. Urine will at least tell me that I don't have to worry about it. And I will give one advice to patient of hydration, hydration, and hydration. I think most cases you'll be able to pick up like this. Never do typhoid, never do Vidal on day one, never do dengue on day one. If you're doing test, patient's fever has started in say last 3 days, don't ask for IgM dengue, ask for NS1. Because it's not any sense to waste the patient's money. You may have to ask for IgM if the fever does not break for 3 days. And that is again another 1100-1200 rupees. So investigate like this. A severe chest pain while coughing, ask for a chest X-ray. So you have to find, localize, first confirm there is fever, then localizing signs, and then investigations.
Beautiful, sir. It was so crisp and fantastic. I think we should cut this clip and post it and make it go viral. It's beautiful.
Thank you.
Every physician must have a guru like you, sir. Thank you so much.
Thank you.
So I have one question to ask you. When you say fever not breaking, what does it exactly mean?
It means, see, most patients will take a paracetamol or something else, even if you tell them not to take. So the duration of that is 6 hours. If the fever comes earlier than 6 hours, for 24 hours, the fever keeps coming every 2, 3, 4 hours, then you think that, okay, it's not a simple viral fever. And I would at least like to do a CBC, because that CBC may not help me in a diagnosis, but that is my baseline report. Mostly if the patient is a acute case of some infection, I may have to repeat CBC after 3 days, then I compare with the previous report.
Okay.
And 4 parameters to see in CBC: hemoglobin, WBC, hematocrit, PCV. The seriousness of a dengue patient is PCV or hematocrit. If there is hemo concentration, this patient is likely to go into major complications. A PCV also tells you about the dehydration status of the patient. So platelet, CBC, I mean hemoglobin, platelet, PCV and WBC, and the patient is new to you, or your old patient but not done a CBC for 1 year. You have a hemoglobin of 9. How do you know it is acute or chronic anemia? Look at the PCV. Ideally, PCV should be 3 times the hemoglobin. So if you have a hemoglobin of 9 and PCV of 27, 28, this anemia is chronic, nothing to do with fever. Okay?
Fantastic. Thank you so much, sir. Now coming back to our homeopathic discussion, very quickly, if you all can share some remedies which a homeopath can keep handy in monsoon. And on the same lines, if we can give it to our patients, envisaging that there are certain illnesses, we have to give this. So a monsoon kit, maybe, if we can call it as. Yeah. Starting from Dr. Jagose, can you share quickly one short case and remedy?
Sure. So one short case, I had a patient, a middle-aged man, wherein he used to get a cold very often. So while taking the case, one very peculiar feature was there, that whenever he roamed barefooted in his house, he would get a cold. So I asked him, why was that so? So he said, in my house, my full house is made of the floor is made of Italian marble. And in the rainy season, it gets very cold. And of course, being a Jain, so in the house, they don't allow the slippers or the footwear. So they roam barefoot in the house. So he says, whenever the rains come, my Italian marble gets very cold. And of course, I have to walk on it. And after that, I definitely start sneezing. So can you help me out? You see, I've taken a lot of treatment of antihistaminics and so on and so forth, but it is not giving me much relief. You see, so this is a very peculiar, rare, strange, and curious symptom, which we have in our organon. I think so, FL number 154 is there, in which we get hypersensitive to coldness or hypersensitive to cold wind. Now, especially the cold floor, when the soul touches the floor, he starts sneezing. So I think the only remedy is Dalkamara in this case. So Dalkamara was given 1 ml. It was repeated 3 times a day for a period of 3 to 4 days, and the patient was totally all right. So whenever he used to get a cold and cough, I mean, rather a sneezing bout in this season with exposure to the Italian marble when it was cold, Darkamara helped him. And in another case, just a short case of bronchial asthma, in which I took the full case and it came out to be natrum mur, you see, but it wasn't helping him very much. Then I again probed the case and again asked him, please tell me something more about your asthma, in which season it is worse, and so on and so forth. So then he came after maybe 6-7 months. He said that it is worse every rainy season. So now, natrum being the constitutional remedy, and the rainy season aggravates, so the radical will become sulf. So natrum sulf was given to the patient, and in every rainy season he contacts me and he takes natrum sulf from me for a period of 3 months, and he's totally all right. His asthma is totally all right, because asthma, I said, is only in the rainy season. After means in the month of June, July, August, the asthma will start. So this is the 2 short cases in which sometimes the patient forgets to tell you certain important points, as a result of which, I mean, you are not at fault, but the patient is at fault. So you cannot identify the correct remedy. And well, there are many remedies which are useful for the rainy season, but the most important one will be Rustox. So Rustox, Gelsemium, Antim-Tart, Antim-Ars, Belladonna, Allium cepa, phosphorus, causticum. I think so. All this can be kept in our kit with a few specific indications of how to use it. You see, phosphorus will be very useful in complaints which come before the rainy season. During the rainy season, causticum would become useful, and rainy season aggravates. Natrum sulf, Rustox, sulfur, lemna minor also comes into action. And fever after getting wet in the rain, remedies will be Rustox, natrum sulf, sulfur, even calcarea, dulcamara, and ferrum can come up.
You know, that just reminds me, I'm basically from Pune. So, you know, monsoons, the favorite pastime is going to see Hagar. And there actually clouds descend on the hill, and we are walking through the clouds. So typically when we were in college, we used to carry Rustox with us, because by the time you descend down from the mountain, entire body would be sore and there will be some aches and pains because you walked so much in the clouds. That's and true. It would help every single time.
Okay, and just one more thing you said about Pune. Even the Congress grass is rampant in Pune. So people have an allergy to Congress grass also. Even in our place here near Borivali side, if you go in the train, Congress grass grows rampantly. So another important remedy.
I think most part of Maharashtra, Congress grass goes very
So another important remedy is Parthenium. Please remember Parthenium for Congress grass. Yes, Congress grass allergy. That's very good.
Lovely. So Hema ma'am, can you share some remedies which sir has not spoken about?
Okay. So we've been talking about urban. I would go to rural now, because the scenario is different when you go to rural in monsoon. Yes. And we have come across so many epidemics, and I would like to share about Tinea pedis, which is so very common in rural, because there is a lot of accumulation of water and they just roam around without shoes and chappals. And we have come across, I think, remedies almost all are covered by Dr. Jagose. But mainly what we came across were sulfur, pulsatilla, and graphitis during that period. And fourth one was Merxol for Tinea pedis. And we could really abort the whole, like we did give selected pulsatilla at one moment as a genus epidemicus and was given to all. Because I think apart from medicine, hygiene and taking care of lifestyle and all are equally important, because dampness, how to use clothes, what should be done was also made them aware about. Another important case which just strikes me, because normally we go with the common things. Ki bhai, monsoon hai, dysentery hai, mercurius can come up, Merxol. And I had an experience that I started with Merxol in a case and it was admitted in the hospital. Normally Merxol and 2 doses, and you do get result. And there was fever with sticky mucus in the stool and all, and I was very clear about Merxol 200, then Merxol 1M. And then I said something is wrong, because I think in acute, if you do not get result within hours, then there is something wrong. And then I went back to the patient and I'm taking history again. The only important point that patient told mother that his stool is like a जो पत्ता होता है ना ट्री का, ऐसा ही होता है जैसे पालक होता है. And then on referring to the repertory, chamomilla was the remedy where it is like a green leaf, and chamomilla was given and patient improved, like because it was in IPD, so temperature chart was there, everything was measured, number of stool and all. So I think many a times we do go into routinist at times that it can be only Merxol. So I think individualistic characteristic that we as a homeopath may not miss out, which we do miss out quite often.
We must think about it.
Yes.
We should be unprejudiced. We should be unprejudiced.
Yes.
Unprejudiced towards our remedies, because
Absolutely.
as we add years to our practice, I think we go on adding favorite remedies and we become partial to them. Blindly, we will start thinking about, asthma in monsoon, natrum self finish it off.
Correct.
But if you go to Fatak, asthma in humid weather, only one remedy. You know which one? Baraita. So it can surprise you sometimes. Dr. Yogesh, let us.
I'll just add one more point that in malaria, many a times deep acting constitutional remedy also comes up as a indicated remedy during the paroxysm. So that's one important thing. Dr. Yogesh can go.
Mind. Beautiful. Dr. Yogesh, you're on mute.
So, other than what all have shared about remedies, few snake Ophidia group remedies are also there, where they are having the indications like fear of rain, elapsed naja is there. And if you go for rain in general aggravation, there is one rubric, rain general aggravation. So Dulcamara, naja, phytolacca is also there, natrum sulf is there. And again, I had searched for phytolacca in rheumatic complaints, where sadness, rheumatic complaints in rain aggravation, phytolacca is the indicated only remedy. Okay, so I'll just share a chronic case in a few minutes. A case of ankylosing spondylitis, where the person was having this disease since 6 years. He was on steroids, and when he came to me, as it was referred by the orthopedician, as he was not responding and he had lots of anxiety. So to just get rid of the patient, he referred it to me. Okay, and on examining, means while case taking, I found that he had that fear for rain. Now I asked why you had this kind of fear, because he said that I am an auto rickshaw driver and I have to be continuously moving around, and during monsoon, I supposed to rain. So that I had this, the moment I get pain, other features were also matching criteria. And when I searched for fear of, so I get into further understanding the anxiety part. So under anxiety also calcarea was there. So I prescribed calcarea 200 to that patient, and he is much better with the treatment. So these remedies can definitely help us.
Lovely. So, Dr. Jagose, you were saying something before we started with Dr. Yogesh.
Regarding what?
After HEMA ma'am stopped, you wanted to add something. Was it a case?
Okay, I'll just tell you regarding this fungal infection. Even I found sulfur very, very useful in intertrigger infections, especially in the groins, on the buttocks, in the armpits. You see, so generally when the symptom match, I give sulfur 10 pills dissolved in water every morning, and I continue it until the symptoms totally disappear. Because if you only give one dose, wait and watch, it doesn't work. You have to constantly stimulate the vital force by giving sulfur every morning, and I mean, in the third, I generally give the 30th potency, and it does improve. So sulfur also is a very important
Yeah.
remedy for such conditions. I would like to add. In my practice, I've seen many cases being treated with sulfur itself.
So, we've spoken most of the acute presentations so far. What are the chronic diseases which you see commonly in your practice which exacerbate in monsoons? Asthma we spoke is
Yes.
one.
Yes.
What
Then,
are the other illnesses?
Musculoskeletal disorders are there.
right.
Tonsillitis, pharyngitis is also there.
Yes.
Acute exacerbation more prominently.
Yes. Fungal infections.
Fungal infection.
Fungal
Yes,
infections are
absolutely.
also there. Right.
Okay. All right. And what you were mentioning, Dr. Yogesh, about the Ophidia group, in general, is it because, monsoons affect their habitat,
Yes, yes, yes.
and
Yes,
that
yes.
is why it
There
is
is a
aggravated?
symbolic relationship.
Symbolic
Definitely.
relationship. Yeah.
Yes, yes, yes.
Fantastic. Any GI cases? Because we spoke of pakoras and monsoon munching habits and things like that. So any GI cases you can mention? Dr. Hema, you've seen any cases?
Yeah, GI cases, 2 to 3 remedies which comes up is, of course, carbovich, nux vomica, and mercurius, if at all there is dysentery. So these are the 3 which we really need to understand, looking to the modalities that, tenesmus is better after stool or it is aggravating after stool. So we do come across cases of GIT, of course.
Beautiful, beautiful. I think
Yeah.
we've discussed. Yes, sir.
Hydration during GIT, hydration apart from homeopathic medicines, hydration and modified means diet pattern has also to be matched properly.
Correct.
It
Correct.
has to be fixed.
That just brings me to a very beautiful concept, Yogesh. In India, we have Chaturmas, 4 months wherein we follow certain diet pattern. Like earlier, it used to be no onion and garlic because it used to get completely rotten, and it is unhealthy to have that. And that is why for 4 months, we would stop onion, garlic. We would stop leafy green vegetables. Now
During
we don't follow all those things, right? And we call those people who are following these methods as traditional or conservative, whereas it was so very scientific. Another method which I genuinely like is people used to fast in monsoon, because our stomach also requires rest, because monsoon used to limit activities. So a lot of times diabetics come up with little aggravation in monsoon typically because they are not able to go out and do their walks or whatever. So fasting in Chaturmas was not for religious purposes, but was a scientific method. And I think we must adopt it in some form. Yeah. So just ancillary measures, preventive measures, what we can give as a standard advice to people in monsoon.
Those who are having any sort of abdominal complaints, they should maintain diet, a proper diet, bland diet you can say, and hydration. Then if there are no complaints, then they should, along with that, boiled water is also there that we have to advise them.
Boiling water, and at places wherein there is the filtration is difficult, at least boil it, use alum.
Yes.
Yeah.
Yes, yes.
These are the things. Yes, absolutely. And wherever there is, the common
cooked food is equally important rather than having raw food.
Yes, perfect. And stop mangoes. Because nowadays the mangoes used to stop earlier in the month of June, but now we see that even in August we are getting mangoes.
And watermelon is also there.
Watermelon is also there. We should stop that.
Stop that. Yes.
Yes, yes. Very important point Dr. Vaishali Bhagat is mentioning in the chat box, non-veg.
Non-veg, right?
Earlier, people used to stop having non-veg in Chaturmas, and typically during Shravan at least. So there is a concept of Gatari Amaucha.
Weird thing. That is, it is attributed in a weird way and celebrated also wrongly.
In a very wrong manner. Yes.
Wrong
But the science behind it is because, you know, the cattle or the poultry which is feeding, and they will be contaminated, and whatever is there inside their stomach, that may not be cooked properly, and therefore you might have GI disturbances. That is the scientific reason for not having not consuming non-veg during monsoons, right?
I would like to add something here.
Yes, sir.
I have put off my video because of the darkness in the car.
Okay.
See, patients have to be told that your daily intake has to be 20% more than your usual intake, because your body is fighting an infection. And they have to be specifically told of water 2 liters and another 700-800 ml of some other fluid. They can take soups, they can take buttermilk, they can take ORS, whatever. Special diets, like, you know, if a patient asks me, no, can I take chicken tikka? I said, if you can eat it and retain it and no issue, you can take chicken tikka. But if I'm treating a URTI, I will not allow spicy food and oily food. But if I'm not treating URTI, I will say, okay, nausea zyada lagta hai, vanilla ice cream kha lo. Because their fever is not because of ice cream.
Yes.
It is only if the throat is at the seat of infection, you avoid ice cream, otherwise you can give everything. So I will allow everything. I even allow non-veg to people suffering from acute hepatitis with a SGPT of 4,000. Because that is, you think Americans will give up non-veg? No. My brother in Bridge Candy Hospital for acute infective hepatitis was given roasted chicken for breakfast every day. Dr. Jagos?
Yes, sir.
You tell me, in a certain community, will they stop eating non-veg because they have fever? No, they will not.
No, not at all. In our community, practically everyone is non-veg. So
that is what I'm saying, that we should not go by
absolutely
the
right.
Dadi Ma ka tales, you know.
Right. Yeah,
And starve the fever is wrong. You cannot starve the fever. You have to feed the fever.
Correct. That's right.
And if the patient say no, like this is my logic. A dengue patient, if you hydrate and give good nutrition, can go to work on 3rd day. Without hydration, takes 7 days to go back to work. Okay, please continue. That is enough from me.
There are some questions like what remedies can be thought of for skin issues due to humidness, except rust tox and sulfur?
Well, basically, any symptom according to symptom similarity will work. There are no specifics in homeopathy.
We did speak about graphitis and
yeah,
Dalkamara also.
Yeah.
Yeah.
The totality demands
will
prescribe.
Yes. And somebody is asking, lot of itching eruptions in rainy season come. So some medicine can you suggest? I think symptom similarity will help.
Absolutely.
Finding out the right
ancillary
remedy.
measures also. Advising ancillary measures also.
Yes. So keeping it dry and, you know, change of clothes.
Extra pair of clothes.
Extra pair of clothes.
So that the dampness won't affect.
Yes.
That is the main
to
reason.
Make sure clothes are dried properly.
Right. Yes.
Typically, I advise children to carry extra pair of socks to school.
Yes.
Because
that
you know they have the wetness, dampness. Mostly it stays inside the shoe, and nowadays schools are also AC. So with wet feet, if children sit in the school, it becomes difficult. There can be fungal infection, tinea pedis can also. So not only rural places, but in urban situations also we have those kind of illnesses. Um, Another thing, what is to be done in rainy season typically is, yes, extra pair of clothes. Carrying that is essential. Having your own towels and napkins in a plastic in your bag, so that you can at least dry your hair and dry the essential areas and keep it dry. Dr. Ketan is suggesting cantharis. Yes, sir. Cantharis is that one of the remedy. Then graphitis, we have already said. Mesarium comes up very commonly in eruptions. So these are the some of the remedies.
Calcarea sulf is also helpful.
Calcarea sulf, oleander will help. Yes. So a lot of remedies will come up. Fantastic. So we have discussed into details about what illnesses we encounter. We have clinical examinations and investigations. Sir has given a beautiful treatise on. Dr. Jagose has given us philosophical background as to how and when should we select remedies. He's even quoted organon. Dr. Hema has shared her beautiful cases, and Dr. Yogesh has given ancillary measures. So with that, I think we are well equipped to face the monsoon weather now, isn't it?
And
Yeah.
few rubrics also from my side.
Few rubrics, yes, absolutely. We have seen rubrics and the single remedy rubrics. So
Yes.
beautiful, beautiful. It's really fantastic when we all sit and talk about these illnesses, and we bring so much value to homeopathic practice. So thank you so much for joining us. We have the entire year planned out. So I would again invite you all to join us in our Telegram group and join us on Facebook Lives. Keep watching it. Somebody asked us to give you the recording for Dr. Asrani sir's talk, part of the talk. So if anybody has joined in late, let me just tell you that on NJH homeopathy page on Facebook, we have this video live. So it will stay on Facebook. If you have missed any part, just go and watch it again. Yeah. And sometime we will again put it on YouTube as well. So thank you so much. This is Dr. Vrishali signing off from today. And we have a beautiful issue of monsoon ailment, which Yogesh is focusing on. So it's a lovely, lovely issue this time, and beautiful cases with a lot of information. Yeah. So thank you so
Yes.
much. Keep writing in NJH. Stay happy and stay connected. Thank you. Good
Thank
night.
you very much. Thank you.
Thank you.
Bye-bye.
We
Bye-bye.
missed VP,
Thank you.
madam.
Good night.
We definitely
Anyway.
missed her.
Yes.
But,
Okay.
I don't know how to say that, so
I
I'm
know, I
keeping
know.
quiet.
Fine. Okay. Thank you.
Okay, bye-bye.
Okay,
Thank you,
bye-bye.
Rushali.